Hello and welcome to this information session on the Masters of Pharmacy, the MPharm program at Ulster University. I am Dr. Aaron Courtney. I'm a lecturer in clinical pharmacy and I am the course director for the MPharm program here at Ulster University on the Coleraine campus. This is the program that you undertake should you wish to become a registered pharmacist with the PSNI, the Pharmaceutical Society of Northern Ireland, or indeed the GPHC, the General Pharmaceutical Council in Great Britain. You can see on screen here a short quote from one of our past graduates. The single best decision I made as a 17-year-old was to select pharmacy at Ulster University, and I am absolutely delighted to see quotes like that. We are very proud of our graduates, and they often go on to fulfill very distinguished careers in the world of pharmacy. We are based at the Coleraine campus within Ulster University. Of course, Ulster University is a 4-campus site. We're based on Coleraine along the north coast of Northern Ireland. Campus includes modern teaching facilities, the Riverside Theatre and state-of-the-art sports complexes. And we're very close to walking trails and must-see tourist attractions along the north coast. We're right beside the bustling seaside towns of Portrush and Portstewart, and there's always plenty to do on campus and around campus, and students really report enjoying their experience and time with us. What we're going to look at today is really some information on why you would want to study pharmacy, and specifically at Ulster University, what you would learn if you were to undertake the course, how you would be taught, what support we provide, and you can also see what other students think of the course, and we'll look at some of the career options that will be available to you. So I hope you find this a useful short session. So first of all, why would you want to study pharmacy at Ulster? Well, what sets our course apart from other universities is that we have some top-class facilities in terms of specialised teaching laboratories. We have clinical education spaces available. We've been ranked very recently and quite regularly as the top school for pharmacy and pharmacology in the UK. And we pride ourselves on having good staff to student ratios, and we usually have very small class sizes. And what that means is that students can access our academic staff with relative ease, and that's something that students report very positively. What you'll learn while you're here, develop clinical communication skills that allow you to work with patients, with other healthcare professionals. You'll be able to assess and critically evaluate evidence to support safe, rational and cost-effective use of medicines. You'll be able to collaborate with other patients, the public, other healthcare professionals in order to improve patient outcomes, and of course demonstrate how the science of pharmacy is applied in the science, the design and development of medicine. So we cover an entire breadth of the pharmacy curricula. Initially, when you start, you'll see in first year we begin with the foundations of pharmacy, and that's looking at core science skills and introduction to the profession, what working life would be like as a pharmacist, working in the key areas of hospital, community, general practice, and of course industry. As you move into second and third year, we work upwards and through an integrated curriculum where we combine the science and practice elements of what life is like as a pharmacist. That spiral and integrated curriculum continues into our third year, where we look in more depth and knowledge across the range of therapeutic areas. And then in final year, we tie all of this together, looking through case studies in specific therapeutic areas. And this also includes optional modules and a final year project, which has you working on real life research projects that are supervised by our academic staff, and in many instances co-supervised by external partners to the university. So you can see here what our spiraling integrated curriculum looks like. We start with foundations of pharmacy. You look at pharmaceutical biosciences. We'll move up then into the various teaching areas, clinical therapeutics, clinical communication skills, basic physical examination skills, of course, bringing all together the basics of chemistry and biology so that you're in a position at the end of the degree to apply the principles of pharmacy to medicine's provision, medicine's design, and medicine's advice to patients. In terms of how you'll be taught, the MPharm is a fully on-campus, full-time course. So you can see here on the left-hand side picture, this is our pharmacy and pharmaceutical sciences building, in which the majority of our teaching spaces are housed. However, we do, of course, use teaching spaces right across the Coleraine campus. So each module is taught through lectures, workshops, tutorials, and seminars, and this is a mixture of face-to-face, and there will be some online material for you to work through in your own time. We're approximately timetable for 20 hours each week, so it is quite an intensive course, and you will spend a lot of time working with your cohort, your peers and colleagues, developing the skills. We focus very heavily on practical skills, and often we will have assessment of those skills in person rather than written assessments. And each module has a self-directed study component, and this is really what makes up university life, in that you're provided with information that you work through individually and independently on your own with your peers and colleagues, and then of course coming together when we're in class with our academic staff and with patients and other stakeholders that come and deliver on our course. Each student will have an independent research project in their final year, and this, as I said already, is something that is co-supervised with academic staff within the university setting, and of course, if appropriate, we often have outside external experts who come in and also help guide and develop that research. And that's so important because that is research that has real impact related to clinical care of patients, and whether it's right at the beginning of the medicine's development stage in drug design, drug delivery, drug formulation, or right through to medicine's optimization and clinical care and practice, we have research projects across a real breadth of the spectrum. We very much value real-world experience, and work placements are something that we pride ourselves on at Ulster University. Our work placement provision is changing, it's actually enhancing. So what you can see on screen at the moment is that we provide 2 days in first year in both community and hospital pharmacy, and then a range of days in second, third, and fourth year. What we're moving to is a structure whereby our placements will look more aligned with 12 to 13 weeks of experiential placement. So that means across the 4 years, you will be on approximately 12 to 13 weeks of placement. Not only will those placements be in community, in hospital, and hopefully in general practice pharmacy, but they will be experiential placements. And what that means is you won't simply just be observing, you will actually be implementing the skills that we have covered at university setting. You'll be going out into practice, putting your skills to good use, and interacting with healthcare professionals and patients in setting. So very exciting, and something that our students currently report as very positive. In terms of how we can support you, we have a range of processes in place, and pastoral care and support is something that we very much value and have at the core of our curriculum and as the wider School of Pharmacy and Pharmaceutical Sciences strategy. We have, from day one, we'll have buddy systems that you will be paired up with more senior students within the cohorts. We have open door policies with staff, and certainly online contact. You can send emails or make phone calls at any stage, and staff will be more than happy to meet with you and discuss any issues or address any questions that you have. Small class sizes permits the fact then that we have good connections between students in various year groups. So we find that our year groups blend very nicely together, and they actually get to know one another, and in many cases develop lifelong friends while they're at the university. Obviously, in final year, you will have a dissertation supervisor, and that's a direct point of contact that you can get in touch with. We have a studies advisor process that you are assigned from day one, and this is a member of staff that you will have regular contact with. You'll have weekly meetings in the first instance, and then in second, third, and fourth year, you have meetings as and when you need those meetings. We have online resources available. We have Blackboard Collaborate, for example. Library staff, very approachable, and many of the library staff will run sessions with students if they have specific questions that would like addressed. And we have a range of student support services available through our fantastic student support and wellbeing teams, and those are on all campuses. And here, certainly in the Coleraine campus, we have a fantastic student support and wellbeing team who do some fantastic work and often are able to provide that help and support and guidance that really supplements the academic support that our academic staff provide. I've mentioned already some of the equipment, and certainly if you come and study pharmacy, this will maybe mean more to you at that stage. But we do have some fantastic equipment on site. We have a fully functional model pharmacy suite, And this is where our students will work in the dispensary and responding to symptoms, working with patients, developing prescribing skills. We also have a fully functional and industry standard aseptic suite. And this is an area, it's a full-size room, a laboratory space where students can go in. They get gowned up, and you can see that from the central image here on screen. And you actually develop medicines in an aseptic fashion. So those are medicines that would be delivered to patients who are in hospitals, and certainly using IV administration techniques, for example. We have NMRs, we have a fantastic new mass spectrometer suite with a whole range of high-end kit. We have FTIR spectrometers, we have masterizers, and a range of analytical techniques: reverse phase, high performance liquid chromatography, UV vis, and fluorescence spectrometers, all of which our students have access to throughout the course. And obviously, depending on the research project that you select, that can often have an impact on the various techniques and equipment that you have access to during the course. This is one of our past graduates. This was Prithumal Joy, and you can see some of the information that she has put and left with us for us to use in our advertising materials. So just want to highlight a few points here. Why did I decide to apply? Well, I decided to apply to pharmacy because I was interested in working in a healthcare profession since a very young age, and pharmacy was the ideal course for me. And certainly if you feel that you have a place in healthcare provision, then pharmacy is an ideal course, and certainly we would love to see you here at Ulster University. I also want to show you, draw your attention to what support did I receive. I received many supports. I was able to email a lecturer if I had a question about their content, and they would email back promptly. I also had support from my studies advisor, my school buddy, and I was able to discuss any problems I had. The university also provided me with student support if I needed anyone to talk to. And that is something that many of our students report. They find that the pastoral care and support is a really important element and draw to our course and our site. We will bring in industry and clinical experts to speak to students. So although we have a fantastic academic staff team, we also rely very heavily on local and international external collaborators who come in and talk to our students and bring that real world experience with them. So for example, we have clinical pharmacists, experts in antimicrobial stewardship, renal care, palliative care, respiratory, a whole range of specialist services, independent pharmacy prescribers from general practice and secondary care, and of course a range of pharmacists from the pharmaceutical industry in relation to quality control and quality assurance. Being a school of pharmacy and pharmaceutical sciences, the fact that we have both elements of clinical practice, industry and research all together means that we're in a very strong position to provide that breadth and depth to all of our students who come in through the door. We have patient-public involvement dotted throughout the course, and this is something that you'll see in every year of study. And this is where we bring in patients and members of the public who are related to specific areas, so Parkinson's, respiratory, Alzheimer's, diabetes, for example. We bring patients in who are living with these conditions so that our students can get the experience of speaking with them and hearing from them firsthand what the issues they face. And that gives our students a real advantage in terms of when they go out to placement and they go out to the profession as to how to act in an empathetic and professional manner. We work very closely with the other healthcare professional students that we have on campus and across the campuses, whether it's nursing, dietetics, optometry, biomedical science students, or indeed the medical students up in Magee. We have a range of interprofessional learning sessions, and this is where we bring students together from the different courses. And that gives the students an opportunity to not only learn what the role of a pharmacist is, but also to learn the role of nursing colleagues, dietetic colleagues, medical colleagues, and see where you fit within the wider healthcare infrastructure. And again, it's something that's really beneficial. It also helps to develop professional networks and create links so that when you go out into practice, you're in a strong position to progress. What our graduates are in high demand for? Well, really it's their practical and professional skills. Employers want high quality, accredited and recognized qualifications, of which we absolutely have here at Ulster. Students that have an ability to problem solve, to project manage and to work within teams, and to be able to communicate your ideas clearly. And that's something that we focus very much on in our assessments. And so you'll find assessments here on our course being both individually written, but also very much looking at group work and the ability to communicate. So real world experience and practice coming through there. In terms of future careers in pharmacy, once you have graduated with the MPharm degree, you have to undertake a foundation training year. This was previously known as the pre-registration year, and this is something that is done through the Pharmaceutical Society of Northern Ireland and a group called NICPLD. So this is something that you will learn an awful lot about throughout your course, but should you wish to register as a pharmacist, you will have to undertake that foundation year training. In terms of future careers as a pharmacist, certainly you can work in community pharmacy, in hospital, general practice, in industry, non-government organizations, for example. High starting salaries, 24,000 and above, right up to 30,000. If you're working in community pharmacy or in hospital pharmacy, many pharmacists will come out earning £30,000 and above. So currently there is a shortage of pharmacists in many areas of the UK. 100% of our students are in employment within 6 months of graduating, which is a fantastic output figure. In terms of the foundation training year, you can see here that there are plans in the pharmacy profession that pharmacists will now register as independent prescribers, and as part of our role here at university, we will be preparing you for that. So that's a very exciting development and something that we look forward to with anticipation. You can see here from one of our graduates, Laura Hutchinson, studying at Ulster is one of the best decisions I've ever made. Extremely supportive, tight-knit community, unlike other university experiences. Following graduation, I've had the opportunity to continue studying at Ulster whilst completing a PhD. So not only can you use your MPharm degree to progress and become a pharmacist, you can also go on to higher degrees and research focused settings, which really does open up the door in terms of future opportunities. So this is a fantastic gateway qualification to get you registered as a pharmacist and to take you further in your studies. We speak with stakeholders very regularly, and making sure that we're meeting the needs of our employers is very important to us. So back in 2019, we had our employer survey, and 100% of employers who took part in the survey agreed that Ulster pharmacy students had good communication and collaborative skills, professionalism, confidence, reflective and flexibility, and certainly employability. So you can see here that obviously we're doing something right, and we're delighted to be able to report that the employers who are employing our students are in agreement with that. The MPharm program across the United Kingdom is going through a range of changes currently, and those changes will be in place by the time you come to our pharmacy degree process. We are being accredited currently, as are all schools of pharmacy across the UK. So this is something that's happening across all schools. And the impact is likely to have a greater emphasis on clinical and prescribing skills and longer periods of experiential learning. And we've discussed that already. We anticipate that in the universities in Northern Ireland, we will have 12 to 13 weeks of experiential placement, and this will be in place for when you come to join our pharmacy course. So in brief, if you have any questions or any information you would like to look up, you can scan the QR code at the bottom right-hand corner of the screen. Alternatively, you can look up our university website, and if you search for the B230 code, that will bring you to the MPharm pharmacy degree. So in very short, you can see information that we've provided, overview, study in one of the top pharmacy schools in the UK. You will learn in specialist on-site facilities, industry placements, clinical placements, teaching and assessment. We have a range of, we'll have lectures, practice-based learning, integrated science with practice, a range of assessment techniques so that you can demonstrate your skills. Real-world experience, we have access to part-time work through Pharmacy Job Shop, for example, and that's where we advertise jobs locally and across Northern Ireland and the UK for our students to benefit from. In terms of accreditation, the course is accredited by the General Pharmaceutical Council in Great Britain, and in tandem the Pharmaceutical Society of Northern Ireland. So very high degree of regulation, and a very strong seal of approval from our professional bodies there. Courses are continually reviewed and take advantage of new teaching approaches and developments in research, industry and profession. So please be aware that modules that you currently see online may change for your year of entry. And certainly with the new clinical focus of the course that is happening across the UK, you will notice that some of those modules are changes and updated. But please do get in touch with the course team for the most up-to-date module list if you have any questions. In terms of entry requirements, these are reviewed on a year-by-year basis. So your best place to get the most up-to-date advice is to go on to the Ulster University website and search for that B230 MPharm code, and that will take you to the homepage for the MPharm. There you will find all of the entry requirements. If you have any questions at all about equivalencies or specific questions about any exceptional circumstances, please do get in touch with our admissions team. There's an email on screen, admissions@ulster.ac.uk, and they will be more than happy to help you. We recognise here at Ulster that there are many ways to gain qualifications, and there is value in a lot of the qualifications that students are undertaking. So whether it's A-levels, higher, or some other alternative, please do get in touch, and our admissions team can certainly advise on that. It would be great to see you all at the School of Pharmacy in years to come. I would encourage you all to apply now, and if you have any questions, please feel free to get in touch with the university through admissions, contact the school directly, and we'd be more than happy to speak with you. Thank you very much for your time, and I look forward to seeing you in the years to come.